Hi, I'm Dr. Jocelyn Idema, Orthopaedic Spine Surgeon with Advanced Orthopaedics and Rehab. If this is your first time here, thank you for joining me today for this live Zoom webinar and Facebook live stream. Today, we're going to talk about the top 5 questions to ask your spine surgeon. So let's get started. Before we begin, if you're watching from Facebook Live, make sure you hit that like or wow button if you can hear me loud and clear. And drop me a comment. Let me know where you're watching from. So there is a disclaimer before we get started. None of what I'm talking about is to be considered medical information. So if you really have a question based on things that we talk about today, make sure to talk to your medical provider and set up an appointment or maybe even an appointment with me. So question number 1, do I really need this procedure? So it's very unusual, at least for me, to have a very first meeting with a patient and we discover that they need surgery right away. Typically, I'm seeing the patient for the first time and we're talking about what have they done so far and how has this affected their pain? Are they feeling better? Are they feeling worse? It's very unusual to go right to surgery. So how did we get to this point? What exactly is going on with my neck or my back? Do you really understand what's going on? Or are these kind of vast terms that people have just been throwing around and no one's actually shown you your x-rays or your MRI or your CT scan? Have all conservative measures been explored? Have you been through physical therapy? Have you tried a chiropractor? Have you even tried acupuncture, acupressure? These are all wonderful modalities to try. Have you been offered alternatives to surgery? There's different medications, there's injections, any sorts of things. Has it been discussed that this is an elective procedure? Now, an elective procedure means that it's not urgent, it's not life-saving, and it's not emergent. It's a surgery that you choose to go forward with the understanding that it's supposed to help with the pain that you're having. So it's not an emergency. Some absolute indications for spine surgery would be any neurologic deficit, like you have weakness in your arm or weakness in your leg, and that weakness is causing you to maybe trip because your foot's not working appropriately. Or if you start to have issues with going to the bathroom. Those are things that we as the spine surgeon, those are our red flags to talk about. So what we just talked about there, drop me a comment below. Let me know if this has ever happened to you. Have you ever walked into your surgeon's office, meeting them for the first time, and they drop this bomb on you? You need surgery and we're going to set it up next week. How did you handle the situation? Or how did your spine surgeon present the discussion of surgery to you? Let me know. Okay, number 2. So we've decided that we can consider doing surgery. Am I even a good surgical candidate? Did you go through the risks, the benefits, the alternatives, the potential complications of this procedure? All of those should be laid out to you prior to your surgery. Are there any concerns with your medical conditions? Maybe you have high blood pressure, or you're a diabetic, or you're overweight. All of these things can influence what happens during surgery, especially with any anesthetics that are going to be applied, or even your recovery afterwards can affect. So which ones and what happens? Have you gotten all your medical clearances? So if you have asthma, we might want to get pulmonology involved to make sure that you're going to be okay with the general anesthetic and having a breathing tube put down your throat, or maybe there's something alternatively that we need to do. Or do you have sleep apnea and you need to bring your CPAP device with you to surgery? All those sort of things. What types of labs do I need? Do I need to get updated films? So typical labs that a surgeon requires and even anesthesia requires are your bleeding times. So you'll have a lab for that. What your electrolytes look like, because the general anesthetic can affect them. If you're over the age of 50, typically we send you for an EKG to check on your heart and just a generalized chest x-ray to make sure that we know if there's anything going on that needs to be followed up as far as that's concerned. The third question is, what is your surgeon's training and experience? So what's the difference between board certified and board eligible? These are terms thrown around all the time, but I don't know if anyone's actually explained that to you. So a board eligible surgeon is a physician. They've graduated from medical school. They've graduated from residency, which is the training of them being a surgeon. And now they're out on their own, but they haven't completed all of the certificates to become board certified. So they're still, not that they're still in training, but there are specific requirements to becoming board certified. Once you're board certified, it means that your specialty, in my case, orthopedic spine surgery, panels or groups of other surgeons have reviewed my work and have come and watched me operate and said, yes, she's ready to go. We're standing behind her and she's safe to go forward. Is your spine surgeon fellowship trained? So that is an extended education after your residency or your training. So for me, I went through a full year after orthopedic residency to just do spine surgery. And that makes me fellowship trained. There are other physicians who, when they were trained years ago, they were trained in all specialties, including spine. So it was not uncommon to go see your general orthopedist who would do knee replacements, fix fractures, but also perform some of the spine surgeries that we do today. Now, today, things are a lot more specific. So my recommendation would be to always look for someone who is fellowship trained. The next step is to ask, what is the success rate for this particular surgery? And I would say ask them in their hands. So there may be a national success rate, but that's kind of an average. So you have some surgeons who are really good at this procedure and do them all the time, and some surgeons that only do them on occasion. So ask them how often they do this and what is their success rate. And then my least favorite questions is, will it fix me? So for me, that's the F word, because there is no complete and total fix. Spine surgery is still a developing field. And that's one of the reasons I became excited and really wanted to pursue it, because we're still trying to figure everything out. So there is no 100% guarantee, but you should be able to give a statistic about a realistic expectation about what is this going to do for my pain, how much of it should be gone in what relative period of time, etc. Again, how many times have they done this procedure? Is this common for them? Is this something they don't do on an occasion because it's a little more specific? And the last thing that I always offer my patients is to get a second opinion. It never hurts to have someone else take a look at the same studies and x-rays and physical exam that I've done on the patient and have that surgeon come up with this same conclusion that I did. Okay. It makes, well, I tell them it makes them feel a little bit more legitimized that when they agree to go forward with surgery, hey, it's not just one person's opinion. I have two people agreeing. But we're kind of like chefs. You may have somebody who approaches it at a different direction, and you may wish to go that direction. And as far as I'm concerned, I want the best thing for my patient. And if that means that they are feeling more comfortable and they'd like to go in a different direction with that surgeon, then I'm okay with that. The next question is, does your surgeon perform the entire surgery? So as we were talking before, when you're a resident or a fellow, you're a surgeon in training. And so there are certain places that are more an academic setting. So we get these really big hospitals that have a training program and they carry really big statistics, and people throw things around like, well, I went to Hopkins, so I would have had to have had great surgery, which is more than likely true, but it's an academic place. So there's a chance that you were either partially or fully operated on by a resident or a fellow with an attending, meaning the person that's been out and doing this a long time, assisting and supervising in the room. So some questions to ask if you're in that setting are, do you perform the spine surgery from start to finish? Is anyone else present during the procedure? And what is their role during the procedure? Are residents or fellows in the room? Are residents or fellows going to be performing a part or most of the procedure on me? Or can I request that you are the only one that performs the surgery? These are all questions that are more than appropriate to ask. And then who's performing the postoperative check, your follow-up after surgery? Are we going to be seeing the surgeon? Are we going to be seeing the resident or the fellow? Or are we going to be seeing potentially the surgeon's physician assistant? These are all reasonable questions to ask. Question number 5, what can I expect after surgery? So what we're talking about are realistic expectations. What happens before, during, and after my surgery? So typically before surgery, you're given a handout about what the surgery is, when to show up. For my patients, they get a little preoperative handbook, which involves the home physical therapist coming to the house, reviewing your house and making sure everything is safe. If we need to add railings to the bathroom, or if we need to move rugs to make sure that you can come home in a safe environment, we do. They also show you how appropriately to get out of a chair and out of bed, because you're going to be moving differently after surgery. Expectations day to day and week to week after surgery. These are usually addressed at your follow-up visits. 2-week follow-ups, 6-week follow-ups, where we'll talk to you about what are you doing currently, your restrictions, how we can change them. Are you walking as much as we need you to do? Big question is, what kind of pain will I be in after surgery and for how long? So typically after surgery, we're dealing mostly with incisional pain. So for the first 2 weeks, that's usually the most difficult. At 2 weeks, you should start to be feeling better, and then we'll get you moving a little bit further, but everybody's different. There's a curve that everybody ends up on, and it's all normal. It's within a normal threshold. Setting those expectations beforehand lets people know, oh no, I'm lagging behind. I'm not moving fast enough, or maybe I'm moving too fast and doing things too soon. But this is something that you can ask your surgeon as things go along. Another question would be, what types of medications will I be on and for how long? Obviously, this is a procedure, an incision, so you're going to have antibiotics afterwards. You're going to be on pain medicine. You're more than likely going to be on a muscle relaxer and maybe some multivitamins to help you with the healing process, such as vitamin C and calcium and iron for your strength, because you're going to feel a little run down after surgery and anesthetic. We may also be adding a supplement so that your protein levels will be a little bit higher. And for how long? We'll discuss each one of those as far as the time frame from weeks to months. Will I need a brace after surgery? Some surgeries require a brace and up to 3 months. Some require it for 2 weeks and then you don't need it anymore. So these are questions to ask as far as what to expect when you wake up from surgery. When do I start physical therapy? Again, this is all based on what your particular surgery is. Some patients, such as cervical patients, may not require as much physical therapy unless their arms have been affected and they're feeling very weak. Then, of course, we want to get things nice and strong again. When can I resume normal activities such as driving, going back to work? When can I start exercising again? Because the whole point of doing these types of surgeries is to get you back doing the things that you enjoy doing or things that you're required to do. Everybody needs to work to live. So the faster we can get you back to work safely, the better off you're going to be. So again, I'd like to remind you to just drop me a comment below. Let me know if you've ever experienced any of this and how you dealt with it, or maybe how other friends have dealt with it. But some key points to remember: do your homework and ask lots of questions. Your surgeon should not be upset with you asking lots of questions. It'll actually save with some postoperative phone calls, and it'll take a lot of anxiety away from you and potentially your family member, who I always recommend somebody come with you when we're talking about the potential for surgery. Seek reviews and other people that have had this procedure. There are certain surgeons, myself included, where we belong to some patient advocates, where patients who have gone through a similar surgery, we can hook you up prior to your surgery to talk to that patient who can tell you, what was it like before surgery? How long were you in the hospital? What did you feel like afterwards? What was it like going home? How long did it take for you to feel better? This is a person who's gone through the exact same surgery that you're about to go through, and they can give you some good insight. Now, just remember, most of spine surgery is an elective procedure. So all other things should be ruled out. All other things should be attempted prior to getting to this point. If at any point that you're asking questions to your spine surgeon, they start getting some defensive body language or gestures, should immediately maybe trigger a red flag for you to potentially explore your options deeper. If they seem to be very concrete in giving you, well, this is all that there is to do, there's nothing else to do, you know, I would probably feel uncomfortable myself. So just things to think about. So whether you're watching live or during the rebroadcast, please leave me some comments below. Let me know what types of topics you'd like for me to cover in the future, and we'll do a few questions and answers as well. So make sure to join me next time for more live webinars, Facebook Live, YouTube Live videos, and remember to check my Facebook page, Dr. Jocelyn Idema, for updates and more live topics. See you next time. Bye.